This side event is on advancing inclusive, accessible, and quality ECD services through county-level coordination and investment. And in the context of Kenya's devolved system, the consortium of ECD actors, advocates, childcare providers, faith-based leaders, and representatives from different areas, including marginalized ASAL regions, seek to advance equitable ECD financing and inclusive service delivery. So counties as frontline service providers have the constitutional mandate, and that we understand, to deliver early childhood development and childcare services. So this session recognizes the central role of county governments in ensuring resource allocation, policy implementation, and the integration of services for children aged 0 to 8 years. So strengthening county-level coordination and investment therefore becomes very critical to achieving holistic, equitable, and sustainable ECD outcomes for our children.
In some counties, parents are beginning to see ECDE as a right for their children, not a privilege. But while we can celebrate these milestones, we must also confront an uncomfortable truth, and that is too many children are still being left behind. The recent FCDC baseline survey gives us a stark reality check. In our frontier counties, the average teacher-pupil ratio is 1 to 22, nearly triple the national target of 1 to 25. Only 39% of ECD centers have clean drinking water. Household dietary diversity is critically low, with just 9.1% of households meeting adequate nutrition standards. And while 78% of ECD centers provide school feeding programs, nutrition-specific investments account for barely 1.1% of county budgets. When we break down this further, the gaps become even clearer. Kenya spends about $81 per child on ECD each year. The regional average is $138. Yet global evidence shows that every $1 invested in early childhood development can return up to $17 to the economy through better school performance, high lifetime earnings, and reduced healthcare and social costs. So when we underinvest, we are not saving money. We are losing money.
The 2022 Kenya Demographic and Health Survey also shows that 18% of children under 5 are stunted, and which is an improvement from 26% in 2014, and the DG has actually touched on that. But still, there is a concern in areas with persistent child poverty. Meanwhile, women in Kenya bear the heaviest childcare burden, spending 4.6 times more hours on unpaid care than men. In rural areas, only 73% of children aged 24 to 59 months are developmentally on track, compared to 87% in urban areas. A pilot study in Tharaka Nithi County, conducted in collaboration with Kenyatta University, confirmed that the lack of formal childcare services is a significant barrier to women's economic participation and mental well-being. Key partnerships with stakeholders from various ministries such as health, nutrition, and agriculture are also critical in ensuring that our children are both healthy and prepared to learn. But no county can walk this journey alone. Collaboration between national and county government is essential, especially in developing harmonizing policies, standardizing quality benchmarks, and building ideal ECD infrastructure across the country.
The key takeaway here is that we really cannot afford to ignore the role of the childcare provider in determining the lifelong outcomes for children. And so they need to be recognized and integrated. As much as we are focused on formal institutions, there is a huge service here that is being provided in the informal sector, and our children are in these settings and are vulnerable at a very vulnerable time. But because they have unstable incomes, what we find is, the next slide, is that the ability to pay, even in the informal sector, where it's roughly 50 to 100 shillings per day to look after a child. Next, please. What we find is that almost half of the providers report that parents are not able to consistently pay that 50 to 100 shillings.
Childcare is domiciled under the Department of Gender and Social Services. The CEO is, I think the CEO was around here. If you come to Nairobi, education. If you come to another county, is health. So you can imagine the challenge of working with those counties. So one of the things that we've leveraged is coordinated partnership, that we work very closely with. We are a member of the ECD Network. So those are one of the things that we're leveraging in terms of the coordination that happens at the county level, multi-sectoral coordination at the county level.
In terms of primary health care, where I mentioned that our focus was more on promotive and preventive, we noted that the departments of health allocate an average of 13% resources to the Department of Health to promotive and preventive. And in terms of expenditure, on average, for the 3 years, they were spending around 73. Again, you can see it's like a quarter of the budgeted allocation was not utilized. What about social welfare? For social welfare, we noted that when it comes to allocation, we noted that they allocate 25% of the resources that goes for that department, and in expenditure, they spend roughly, on average, 63%.
Most of the centers that we work with are informal childcare centers, which are the majority. So when we reorganize this, then what happens to them? Please, let's not leave them out in this restructuring. In anything, in terms of financing, they need it. In terms of other service delivery, if they need it, yes, if it's from an aspect of health, all the other government services, these people do need it. And they're serving a very, very, very big population.
Let's not forget the ones who are really marginalized. Even though we think, they're in the remotest of places, they're also equally going to benefit. Let's not leave them behind. Number two, as Aga Khan, we work with a lot of data, and this data is very important, and it can inform different decisions, and especially in infrastructure or even financing, budget allocation. So let's also not let that data just sit there. So that is what I would say from our end. So thank you.
From my end, I'll give my final words on two issues. First, focusing on community programming. We've been talking about children, and it's very key for us to realize that caregivers play a very big role. And from our experience, maternal and paternal mental health are key, and also strengthening relationships and marriages. This has a direct impact to the children. And once you do this with the caregivers, all the other components will just fix themselves. At the institutional level, this is a challenge to us. And when I say us, I mean everybody, because we are government. This is the very first time ECD matters are being discussed in a devolution conference 10 years later. Please let us audit ourselves the next time we are having such. It would be very embarrassing for us to talk about the same things again. So that is a challenge to the government. I know we've learned a lot, but let us audit ourselves. And for the partners, we will put you on track. Thank you.
A few take-homes from the research finding. Number one, which was also mentioned by the earlier speakers, the speaker Wachia County, ring fencing funds that are allocated to early childhood. And what do we mean by ring fencing? You know, it's one thing to use the term. It means setting aside funds for, if it's early childhood education, setting aside funds for that function. Number two, deciding the ceiling, how much should go there. Number three, coming up with a framework on how much should go where. I want to use an example for pre-primary education. If you have set a ceiling of 100 million, how much should go to material development, teacher payment, infrastructure? When you ring fence this, you say 10% of the 100 million will go for infrastructure. If you exhaust that, then you don't go again looking material. There is money in the kitty of material.
We need to have a policy that is inclusive. We already have the Persons with Disability Act. Let us also incorporate this when it comes to ECD, so that we give children with disabilities what they really deserve in terms of access to quality care, access to education, and access to protection. And if we do not do this, then we will perpetuate inequality. We will also perpetuate matters of poverty. And at the end of it, we are going to have a lot of costs in intervening. And so we need to save by investing in our children, especially when they are young, because the first 1,000 days is the most critical in a child's life. So therefore, as the State Department, we remain committed to work with the county governments to enhance quality care for our young children, especially at the age of 0 to 8 years, which is more critical in terms of their development. And we shall also work with the partners who majority are represented here to ensure every child in Kenya has access to quality, affordable care. And also we are enhancing regulation of childcare. And we will be inviting you very soon through our stakeholder engagement to come up with standards on childcare. Thank you very much, and I wish you a good afternoon.
Just the fact that government is showing commitment to the agenda of the early years, I think is something that we need to appreciate. Isn't that so? At least we have government in the main room, national government and also the county government. And we have had a conversation that allows us to go and think further about how we can engage closely. We are taking up your challenge. I know that today there was a competing engagement, and most of the CECs and the directors are actually in the launch of the policy that is happening with the Food for Education team. So that's why we have a smaller crowd here. But I just want to appreciate each one of you for making time, for coming into this room today and spending time with us. We have the communique being prepared. We would like to request that, because we know we are past time, that this communique will be shared with each one of you in your emails, because you've already given us your emails. And if you have not registered or signed up with us, please do so that we can actually communicate with you.